I'm Leslie Burden. I'm physician assistant at Paris Pediatrics. I'm actually from Huntingdon, but I've lived in Paris since the early 90s. This is home for us, and I was fortunate enough to complete my master's in physician assistant studies at Bethel University. Well, after graduating from PA school, I worked for a while in family practice, and then I worked for a couple of years for an ear, nose, and throat surgeon. And although I enjoyed working with adults, I found the greatest satisfaction with working with the kids. They just tend to respond well to treatments. They often dramatically improve, and it's just exciting to see the kids in the office every day. In my spare time, now that my children are grown, I actually have a little bit of more spare time. I enjoy spending time with my family and friends, as well as decorating at home and painting and refinishing furniture. My husband David and I have been married for 29 years, and after we married, we lived in Memphis and then Nashville briefly, and then got the opportunity to come back closer to home. And so in the early 90s, we moved to Paris, and we have 2 children. Actually, my daughter Grace was born here at Henry County Medical Center. She's now 23, and then I have a son, Dylan, that's 26. Henry County Medical Center is just part of my home community. Like I said, one of my children was born here. It's always been just right out my back door. I worked here many years ago in other capacities, and so it's just been like home to me. It's a community hospital, although it's a small hospital. There are a lot of services that they offer. I think they've been a very progressive hospital, although it may not be as big as some of the other hospitals, Jackson or Memphis, but we have a lot to offer here. I would encourage anyone that's looking for a pediatrician's office to actually visit the office and talk to the people there and get a good feel for the clinic. I know at our office we do meet with new moms to talk to them a little bit about how our clinic works. Our clinic is very kid-friendly. I mean, it's all that we do is pediatrics, and we see birth to up to college age. And so we have a variety of patients there, but all of our nurses and our staff are committed to children. We try to alleviate the fears in children and in parents, because that's a big thing. We do a lot of education there, a lot of anticipatory guidance about what to expect during your child's different developmental stages. And so I think that those are the kind of things that you're looking for, is to be preventive health. We see a lot of sick children, but we try to keep them well.